So hi, everyone. I'm Annu Navani, and thanks, Yuli, for the kind introduction. I'm a physician entrepreneur in the Silicon Valley. I'm an interventional pain management physician in Northern California. And I'll tell you a little bit about pain management and the innovations therein. It's really exciting to be here with you all. Here are my disclosures. I'm the founder and CEO of Comprehensive Spine and Sports Center. It's a 12-year-old practice. And as you will notice in the upcoming slides, we are clinical application service-based industry, along with a strong arm in research and development and innovations. Along with that, I'm also faculty at Stanford and have been at Stanford since 2003. And this has allowed me to bring the best of both worlds together, academic and private practice, which I've tried to incorporate at Comprehensive Spine and Sports Center. Rest of the disclosures, I don't think have any direct correlation with the talk today. So we're talking about pain here. Pain has been in news for several decades now, as you all know. It has been in the news in relation to athletes' injuries. It has been in the news in relation to painful conditions that celebrities have had, or addiction to opioids or overdose-related deaths. And it has also been in the news with regards to pain signaling and brain reorganization with presence of chronic pain. And with all of that, you begin to wonder, what is pain and how do you define it? And would it surprise you if I said that there is really no definition of pain to date, or I should say no clear definition of pain? And although we don't quite know how to define it, we have all experienced it and we all know how it feels. So that leads to a very new and exciting field, and definitely a lot of room for innovation to even understand what it is. And pain is everywhere. About 3/4 of American population suffers from low back pain at some or the other point in their life. And if we did a poll right here, I'm sure all of us will raise our hands to having experienced pain somewhere, sometime along our lives. And I don't think you'd be surprised if I said that we spend about $600 billion per year on pain with regards to healthcare costs, loss of productivity costs, lost work-based costs, and so on. And that is more than what we spend on diabetes, heart disease, strokes, you name it, and even cancer, I guess. So pain is a big problem, as I'm sure you will agree with me. Pain is, however, also new and exciting. It's not a very old specialty, and it's not a standalone specialty. In fact, it's an integration of multiple specialties. On one hand, we have medication management with new medications coming out every day. On the other hand, we have minimally invasive surgeries that we can do now as interventional pain providers that can actually offer resolution of the painful problem with minimal downtime. So it really integrates neurosurgery, orthopedics, physical medicine, rehabilitation, anesthesia, rheumatology, neurology, and multiple other specialties. And that's what brings so much innovation to this field. It is new, exciting, and right here in front of us. So having said that, I must also say it's not a bed of roses. It has its own challenges. And with pain management and healthcare delivery in pain, it's really a collaboration of multiple different stakeholders. And any given patient has to go through so many different people: the physical therapists, the surgeons, the interventionalists, the pain management providers. And many times these stakeholders don't talk well with each other and don't talk at all to each other. And that leads to therapies being ineffective and not helping long-term. And that leaves room for innovation, of course. Also, there are other challenges. For example, we still haven't figured out a good way of measuring pain. It's very subjective, and number 6/10 on a scale of 0 to 10 would mean something to me and something different to you. And although there have been innovations with regards to different ways in which we can measure pain, no one standard has really stood the test of time and has clearly shown year after year being the standard of pain measurement. So that leaves room wide open to developing innovations to measure pain. Also, it's a multidimensional experience. Pain can manifest in many phases. Pain can be loss of function to one person and manifest as depression and anxiety in another person. And so expression of pain, how that can be interpreted and treated, is also wide open for innovation. Pain can be because of multiple generators. For example, low back pain could be because of discs, the joints, muscles, nerves, multiple other things. So to be able to pinpoint the diagnosis and get a definitive treatment is a challenge in pain and wide open to innovation. And to date, there are many conditions in pain that have no cure long-term, and again, leading a lot of innovation and research in that field. And until recently, I must say, there were no clear consensus guidelines. And we have been part of organizations that have developed some consensus guidelines, and now we have some. But until recently, we were practicing pain any way we wanted. So these challenges are real, they are here, and they're happening every day, leaving huge room for innovation. So here we are. So these are the innovations that have happened in pain recently. As you can see, I've categorized them as incremental, breakthrough, and transformational. And you can see the categories and what the innovations have been therein. And these explain themselves, of course, and we'll go over some of them. So the pain management strategies as they stand today are essentially medications, minimally invasive procedures such as injections for the nerves, blocking of nerves. There are ways in which we can freeze or burn the nerves. There are ways in which we can modulate the nerves. And then the entire slew of alternative medicine treatments like physical therapy, acupuncture, chiropractic care, psychology, cognitive behavioral therapy, and so on. And although we do have several tools to treat patients with pain, a lot of this care is fragmented and that therefore not effective long-term. Now, these are the device-related innovations that have recently come about. As early as and as recent as January of this year. As you can see, most of these innovations have been related to neurostimulation, which is, in other words, peripheral or spinal cord stimulation. For those of you who are not familiar with it, it's like a pacemaker of the spine. It is associated with leads that are injected in the epidural space. And that then connects to a battery that can be operated by the patient, either wirelessly or through a device that's tunneled in the patient. And the patient then can control the pain in the neck, low back, upper or lower extremities by controlling the type of stimulation they feel, the type of sensation that they feel instead of the pain, and can turn it on and off. And a lot of innovation has come about in terms of the size of the battery, the type of the battery, the type of stimulation, and now there are a lot of ways in which you can stimulate those nerves without, and get rid of the pain without even having any sensation of tingling, which is normally what one feels. Opioids is a hot topic and has been for decades and will be for, I'm sure, for years to come. So opioid-related innovations have also hit the market quite a bit over the last few years, right from biosensors that will allow you to track the medications in your system, all the way to safe dispensing of pills, and even most recently, in last year, Respimeter, which allows you to detect opioid overdose. So having said this, who are we and what do we do in this world of pain and how do we solve the pain problem? So what's Comprehensive Spine and Sports Center? So we are a group of large practice, or we are a large practice group, I should say, with 8 locations in Northern California and going beyond. We are 50 providers. We have about 20 service lines and expanding. And although we are in California now, we are making way outside of the state now, and there are several projects that we are doing outside the state. We have 6 procedure and operating room facilities. Brunt of our work is with clinical care. We see a lot of lives on a daily basis in all our 8 locations. Along with that, we have a keen interest in research and innovation. And there are several products that we have in various stages of development, which I'll briefly touch on. And our focus is spine, musculoskeletal, and orthopedic patients. And we provide interventional and surgical treatments to them. We also have a keen interest in biologics and stem cells and have created a good reputation and quite a name in that, and I'll share that with you. And along with that, we really focus quite a bit on integrative therapies such as acupuncture, chiropractic, physical therapy, yoga, nutrition, psychology, because we really feel to address the patients as a whole, you have to address the whole person. And that involves and should involve a team of multidisciplinary physicians. We are recognized leaders nationally, internationally in our specialty. We have faculty affiliation in leading universities. We are board members of several national and California-based organizations. We have books, editorials, national guidelines that we have authored. And we are a training center internationally for spine, orthopedic, and musculoskeletal, especially when it comes to stem cell treatment. And we have won a few awards that we really are proud of. So here is the group of physicians at Comprehensive Spine and Sports Center. Each one of us are both certified and fellowship trained and have university affiliation. And we all take keen interest in making things better for our patients every day. And in that process, engaging in research, development, and innovation. These are our physician assistants, nurse practitioners on the left-hand side, managers and program leads, who also help us closely in research and innovation. Here are our ancillary providers. We have a team of psychologists, chiropractors, physical therapists, acupuncturists. We have yoga and wellness, nutrition, vocational counseling, and multiple services that help us offer an integrated model to our patients. And we do foster a culture in our company that brings on leadership, innovation, teamwork, and entrepreneurship. So as you can tell, we have great talent in the company, and we are progressive in that we bring that talent in and see what we can do to create products that will help our patients better. And with the whole team, we have been able to accomplish some national guidelines that we've been able to author. Here are guidelines for spine procedures that are very commonly done, epidural guidelines, facet joint guidelines. These are national guidelines that the physicians in the country follow. Opioid guidelines, we are authors in that, which is a huge help, especially during the opioid crisis. And when it comes to biologics and stem cells, we have been instrumental in putting together guidelines with recent advent of stem cell clinics all over the country that has created some issues in creating outcomes that are not very conducive and good. And we have written position statements to the FDA when large organizations come through or larger legislatory bodies come up with guidelines. We do have a say in what we think should be the standard of care. And we are really excited about that. So with regards to research and development in our company, we do both investigator-initiated as well as industry-sponsored research with regards to pharma, device, operations, and biologics, including stem cells. And just to give you a glimpse of what we have been able to accomplish and giving you short, small little examples here, wanted to touch on the biologics and stem cells. So I'd like to share a brief video about the effect of stem cell treatment and what that potential could be in defining the future of medicine. So here you're going to see a video of a wound in a patient, and you're going to see these cells that migrate towards that wound to fill the wound defect. And just like there is a wound on the skin or on the surface of the cell, any injury in the body, be it in the muscle or tendon or the disc or the spine, is a wound to the body. And that's how the natural healing occurs. And with regenerative medicine and biologic use, we can actually exponentially increase the chances of healing. So here is the video. The red is the blood vessel. The stem cells stay as pericytes that are clasped onto the blood vessels. You can see one of the stem cells being circled there and multiple stem cells migrating to the wound and filling it. And you can see how the wound is filling in gradually. I owe this to my friend and researcher, Dr. David Harrell. But it really brings home the point of how significant this could be in the treatment of any tissue injury in our body. We have done quite a bit of work. We have published many articles, including review articles that are being looked at. These are our studies that we have done with platelet-rich plasma and stem cells in lumbar discs. Just to give you a perspective, about 40% of low back pain comes from discs being injured in our body. And we have done extensive work with intradiscal injections with a variety of agents, including stem cells and PRP, which is platelet-rich plasma, and have been able to demonstrate significant benefits in patients with improvement in pain. As you can see in this particular study, we demonstrated 93% of the patients noting more than 50% relief at 18 months. Improvement in function as regards to SF36, which is the quality of life index, 93% of the patients had improvement. Medication use decreased in 80% of the patients at 18 months. There were no adverse events, no hospitalizations or spine surgery. So here is a group of patients who had low back pain, and they could get treatments that were minimally invasive, helpful in healing, and were able to avoid surgery. And what was most exciting to us is also the repair in the disc architecture. So you can see on the screen on the right-hand side, the picture of the disc with the tear, right in where the arrow is pointing, and 6 months post-injection, the disc having, the tear having been repaired and gone. And that has been exciting in terms of being able to repair the disc architecture and give patients a healing treatment rather than just Band-Aid and coverage for pain. We just finished recruitment for our first ever landmark study, looking at PRP versus stem cells. It was a multi-center prospective randomized controlled trial. And the results were quite positive. We actually presented it at the Orthobiologic Institute meeting in June, and the full analysis is in process. And we are very excited about launching this in other countries, actually, as we speak. So in terms of the innovations, coming back to the topic and coming back to the meat of the discussion today, here are some of the efforts we have taken in our company. So talking about opioids again, with COVID, we saw a huge surge of opioid overuse and abuse, and even overdose-related deaths. And we recognized in order to have people get off and stay off opioids, we needed a multidisciplinary approach that was systematic and integrated. And so we put together a detox program acknowledging the importance and in the right systematic way, incorporating all of these different therapies for our patients. And we were able to get about 12-to-1 ROI on this therapy with regards to healthcare costs, in terms of saving patients, in terms of being able to prevent abuse and overdose-related treatments. With regards to other opportunities and challenges, I should say, occupational injuries, I mentioned that, I actually did hear about that earlier, but I'll tell you, occupational injury is a huge issue in our country. And we spend about $150 billion on workers' compensation injuries annually in this country. And we see a lot of those patients come to us who have injuries that can be treated at the right place, right time, and with the right skill set and with the right team. And we can have amazing outcomes. So the medical and functional restorative therapies that we put together are able to decrease the disability in terms of closure of the injury claim, return to work, decrease in medications, decrease reliance on future medical, and decrease in pain and improvement in function. And with our medical and functional restorative therapies, we have been able to have 92% of our patients reduce their medications, 87% of the patients return to work, 91% of patients have improvement in their mood, and 95% patients have functional improvement. And I bring this up, although it sounds like a service-based treatment, but all of these are also products that are able to analyze and interpret the data that we are putting into the system and be able to adapt with the data mining information with statistical programs that we have that could help shape how we administer care to our patients in future. Now, digital health has been on everybody's mind, and especially with the general acceptance of telemedicine during the COVID time, it has served as a great opportunity for us since we are able to offer not only the telemedicine, which is the physician-patient visit, but have been able to incorporate in our telemedicine platform, getting information from social media platforms, from mobile devices, from registries, and be able to incorporate telehealth into our care and be able to offer patients much higher quality of care. And we are building on this every single day. This is the platform we use for our telehealth. And we are really happy to incorporate that into our day-to-day care of the patients. And with regards to transformational, as we are becoming more informed and predictive providers rather than reactive providers that we have been over the years, we are able to bring in more algorithms in our practice that are focused on precision medicine, focused on regenerative medicine, and able to bring more individualized, customized treatments to our patients. So as we move to the new era, there are a lot of projects that we are looking into that incorporate biologic device combinations, nanotechnology, and even AI-related platforms to be able to administer care to the patients. And as the healthcare delivery changes to AI platforms and much more precision medicine-based platforms, some of these sentiments are captured in this article that I wrote a few years ago. And here is some of the work that we have published. So this is a statistical machine learning method that we designed for chronic pain assessment that was published in 2016. And that was with regards to the AI and some of the ideas we had at that time, which have since then matured. Here is our interpretation of what we thought would be the future of disc-related treatment with regards to healing of the discs with biologics and stem cells. And here is a book that actually talks about not only the current therapies, but also future of what we see the regenerative medicine to be. So here is a summary of the innovations that we currently have in our company under the categories that I had mentioned earlier. With regards to devices, we have some projects going on with neurostimulation devices. With regards to methods, we have surgical fusion-based devices that we are working on, as well as operational platforms that we're working on that help with workflow efficiency and communication. With regards to breakthrough innovations, we have patient-centric pain care platform, that's digital health platform that we are working towards. We are also working towards restorative therapy platform, which I gave you a glimpse of, both in the virtual and live platforms. And then, of course, the pain care modeling from predictive analytics standpoint and stem cell applications. These projects are in the entire spectrum. Some of them are in concept stage and some are products that are ready to roll out. And we are very open to strategic partnership with people who may be interested in pain and who may want to work with us and drive this to the next level. So with that, I thank you for your attention and pass it on to you, Yuli.